We are on code red for the planet, and we think we're on code red for a healthy future. And the health impacts of climate change are worsening across every indicator that we've been tracking over the past 6 years. And the impacts of that on heat are terrible, with heat wave exposure increasing by billions of days, vulnerability to that increasing across all countries for various reasons, aging populations, living in cities, underlying health conditions. And there are many other things we could talk about. On the science, well, the Saudi Arabians are making a calculation that they could get to net zero by, diversifying their economy in various ways. India faces a different problem. They've got 1.4 billion people, and many of them are facing really difficult problems with getting access to clean energy. In the poorest countries, only about 1 in 10 households have, primarily their energy source on clean fuels and technologies for cooking. And in rural households, that falls to 5%. Now, we need to do something about that, because if we don't, countries like India are not going to be able to reach their targets. And because the punters will say, why should we? We're not getting clean energy. And they'll still be reliant on things like kerosene and wood and the like.
Is net zero by 2050 then enough to at least stem some of the health crises that you're alluding to? And I note that the report says that climate change is creating the ideal conditions for infectious disease transmission. What type of infectious disease are we talking about?
Well, with infections, we've seen that most of the new and emerging infections come from contact between animals and man, of viruses jumping over, whether it's HIV, whether it's Ebola, whether it's COVID-19, and many, many others that the World Health Organization is having to deal with all the time. And when I worked there, we had the Zika virus. If you take Latin America, for example, in 1970, they had no arboviruses. Now they have yellow fever, dengue fever, Zika virus, chikungunya. They've got, and that's largely because of climate change and the way in which drought and the spread of mosquitoes has really affected what's going on. The same with malaria in high spaces. But actually, 10 years ago, I realized it wasn't just about infectious diseases that will affect the health. It's the heat stress, it's the extreme events which are causing mayhem in small island states, in the Caribbean, in almost every region of the world. And it's food security, because when you have heat, you have extreme drought, which has trebled on average. Nearly 20% of the global land surface is affected by extreme drought. And it's affecting crop yields as well, because as temperatures rise, it shortens the time in which plants reach maturity. And all the major crops are finding that their yields are going down now. So this will ultimately have an effect on food security, food prices, and the like. So there are lots and lots of things happening at the same time. We're on the steep part of the curve. We're only at 1.1 degree, and at the moment we're heading up to above 3 degrees. And so we really need to get our act together fast, because the carbon intensity of the global energy system is falling at a very, very slow rate. And it would take 150 years to get to net zero on current trends.